Can technology truly transform people's lives? Hello, my name is Chiira. I am the director of Innovate Now. Innovate Now is an accelerator program that leverages on the power of technology and entrepreneurship to bring new possibilities of access to assistive technology to persons with disabilities in Africa. It's an initiative of the Global Disability Innovation Hub and AMREF Health Africa. And to date, we have run 4 acceleration cycles where we take in a group of entrepreneurs who are trying to innovate and build new solutions that can increase access to assistive technology in Africa. We have seen solutions across mobility, hearing, visual, and even neurodiverse disabilities. Now, why is access important? Why is access to assistive technology important? Now, according to the WHO and Global Disability Report of 2011, it is estimated that today, more than 1 billion people across the globe do not have access to assistive technology. Let's unpack that a little bit. First of all, what is assistive technology? You might want to think of assistive technology as a collection of systems, services, and even products that help persons with disabilities access assistive products, which enable them to improve function and independence. What do I mean by this? Well, disability is an interesting topic. When you look at the history of disability, for a very long time, it has been looked at from a medical perspective, where the idea is we focus on the person and the condition they have and medically try to correct it. But the reality is, disability is actually not the person. It's actually an interaction of a person's capabilities with the environment. And if there is a discrepancy, then you have barriers to participation. And that really is what disability is about. Because as human beings, we are all equal. We are all born with unlimited potential. And think about it this way. If you live long enough, you will experience reduced function in any of your sensory capabilities. And that means looking at disability entirely from a medical perspective is not going to create a society where everyone has equal access, where everyone is empowered to participate. So let's look at what access means. Well, for a person who cannot walk, for a person who needs a wheelchair, for a person who needs crutches, or for a person who needs glasses, these are called assistive products. And what they do is they help an individual to actually participate in society equally like everyone else and eliminate the barriers in society that prevent or reduce that participation. So if you're talking about 1 billion people across the world and 80% of this being in the global south, that includes the sub-Saharan Africa, surely you are looking at the largest minority in the world. And when you look at where we are in the world today, we are talking about achieving our sustainable development goals. Well, this is not going to be possible if a huge population segment of society is not able to participate. And barriers or lack of participation, what that means is you'll have a child who, because of having a disability, will not go to school. You will have a working age adult, and we've seen it in our communities here in Kenya, working age adults who do not have access to meaningful work, either because they are not empowered to go to work, or that the environment is actually not accessible to them. That's both things like the workplace and also the public transport, not to mention even the healthcare system itself. So if you really look at the cost of lack of participation, it costs society and any country billions of dollars every year if such persons are not empowered to participate. So in actual sense, the empowerment of persons with disability to take part in society, to go about their daily life and get engaged in socio-economic activity has a positive return on investment and is not only a humane thing to do, it actually makes financial sense. Now, what we do at Innovate Now is to try and look at new ways of thinking about those barriers and how to eliminate them. Now, we are talking about the power of technology to bridge access and then move from access to empowerment and then move from empowerment to actually transforming people's lives. And that's where it gets interesting, because you cannot stop at access. We have to really ask ourselves, once a person with disability is empowered with the assistive technology they need, what does that mean to them? If they're a child, will they be able to go to school? If they are a working age adult, will they be able to access employment? And will they be independent, self-confident, and fully participating in all spheres of society? That is a transformation that technology can lead if we actually invest enough. Now, at Innovate Now, what we're trying to say is that innovation today is humanity's path to progress, not just now, but in the future. And we have seen it happening across industries that we thought before were not possible to advance. And I'll talk about access to energy, for example. In this country, a couple of years back, access to electricity was a preserve of the few people living in urban areas. But today, because of innovative solutions to this problem, even in the most remote villages, the countryside, you have people using affordable, renewable energy. And I'm talking about solar. If you look at the cost of solar over the years, it has been reducing almost at an exponential rate. This has enabled entrepreneurs to build new industries in the energy sector, to create new possibilities for those who have been for a long time excluded because of lack of energy. Now you can take the same thinking and apply it to assistive technology. In Africa today, this is an industry that is highly underdeveloped, highly undervalued, and highly underestimated. And therefore it means, as Africans, as countries that are looking to create a prosperous future for the next generation and for the current generation, we have to think about the full inclusion of persons with disabilities in societies by allowing new industries that empower persons with disabilities to emerge. And I'll give a couple of examples of what I mean. For assistive technology to thrive in Africa, we have to make the cost of manufacturing come down. We have to give incentives to investors and entrepreneurs building new solutions to thrive in our market. And we have to look at persons with disabilities not just as beneficiaries or people that need to be helped, but as customers, as people who have preferences, as people who, despite the high prevalence, low purchasing power, still have purchasing power. We have to challenge our business models to actually build solutions that are affordable, and then move beyond that to reimagine our systems, such as the healthcare system, which can be one of the biggest drivers, market drivers, and of uptake of assistive technology, because they aid in provision, they aid in testing, and they aid in access. So innovation for assistive technology, for it to be truly transformative, it has to be done at 3 levels. One, at a market level, we have to promote new innovations and new ways of thinking, like what we are doing at Innovate Now. Level number 2, we have to look at the systems in society that ought to be catalytic and open inclusion for persons with disabilities. And I'm talking about the healthcare sector, I'm talking about the social protection sector, and most importantly, the insurance sector. For us to solve the low penetration rate of insurance, which across the continent is barely above 3%, we have to think of new ways to bring on board people who have been excluded for many decades, if not centuries. And this presents opportunities for all of us to think transformatively and to think of technology as a true enabler, not just of access, but that can actually accelerate empowerment and transformation of society. Now, you may be asking yourself, what is my role? What can I do? There's something that everyone can do, and the one responsibility that I believe all of us as individuals have, one is to change how we think about disability, about persons with disability. We are a highly educated nation. Kenya is a nation almost 60 years old, and our forefathers had 3 major enemies, one of them key being ignorance. We cannot claim to be an educated society if we still think that persons with disabilities are bewitched or have a curse or cannot perform like anyone else in society. And this is both a personal responsibility, but also a responsibility of our education system. Let us teach disability inclusion in schools, right from kindergarten. Let us embrace families and support families who have children with disabilities. And this is where government and the charity sector ought to come in strongly. And let us support local innovation and local capacity, because without establishing this, we cannot truly build a sustainable society. COVID-19 has helped us to think outside the box, to see new possibilities. And one of those is that when all the borders have been closed and you are left on your own as a country, will you be able to meet the needs of your populace? COVID-19 has taught us that for some careers, people can work from home. For a very long time, persons with disabilities have been denied work opportunities because of inaccessible work environments. We are in an era of disruption to the status quo, to how we see the world. And this is the time for radical inclusion and for building a new world that is based on principles of equity and inclusion. And this new world will see a whole new generation of persons with disability thriving in society and creating prosperity for everyone. Thank you very much.